Hi, my name is Kylie. I am going to be performing the skill of drawing up insulin. First thing I'm going to do whenever we have this is I'm going to verify the orders. Orders today are 4 units of regular insulin. So 4 units of regular insulin, 8 units of the intermediate insulin. Once I have verified the orders from the providers, I want to make sure I'm following the 6 rights of medication, which are right patient, right medication, right dose, right route, right time, and right documentation. So after I have done that, I'm going to go ahead and go to the computer and I'll pull up the patient's EHR. I'm going to verify the orders in their MAR with the medications that I have pulled. So I'm going to make sure it's NPH and I'm going to make sure that it's insulin. So I pulled the correct medication, I verified it for the first time, I will gather my supplies and I will head to the patient's room. When I get into the patient's room, I'm going to close the curtain for privacy. I'm going to perform hand hygiene. I'm going to verify the patient with 2 patient identifiers, checking their name and their date of birth. Hi, my name is Kylie. Can you verify your name and date of birth? I'm going to check their wristband, verify the name and date of birth. I am here because there's orders for you to have insulin administered today. Before we get started on that, can you verify if you have any allergies? Any medication, food, or environmental? No? Perfect. So I verified allergies. I am then going to go ahead and perform hand hygiene, and I will get my gloves put on. So I pulled up the orders again. I'm going to verify them in the MAR for the second time now. Perfect. Verified. Okay, so as I stated, I'm here to administer some insulin and an intermediate insulin as well. So what that is for, it's just for diabetic patients, and it's going to help our body to use glucose property to perform properly for energy. Do you have any questions about an insulin? Perfect, great. So a couple side effects with insulin, there could be some tenderness or pain around the injection site, maybe a rash that forms temporarily, or you could experience some weight gain. Some adverse effects that if they occur, I do want to know about immediately would be any irregular heartbeat, palpitations or anything, a headache, or maybe any dizziness. Please let us know, any health professional know about it very quickly if anything happens like that. Just a little heads up, upon administering the insulin, there could be some slight stinging that we've heard about before, but that shouldn't last but more than a second. Do you have any questions now? Perfect. Okay, so I'm going to go ahead and check the patient's blood glucose to make sure they are ready for their insulin. After I've done that, I will let the patient know that I will be bringing them food about 30 minutes after injecting the insulin. Perfect. I'm going to go ahead and verify for the 3rd time, now that I'm at the bedside with the patient, that I have the correct medication. Perfect. Once I have verified that, I will have my fellow nurse come in and verify the calculations. So we're going to have 4 of the insulin and 8 of the intermediate insulin, the NPH, equaling 12 units. My nurse has verified that. After that, I will go ahead and get started. So first thing we're going to do is make sure we roll. This is going to help make sure that if there's anything suspended in the fluid, it's all balanced out. It's going to also help bring the insulin and the NPH to room temperature. I also want to note that one is going to be cloudy, one's going to be clear. Insulin should be a clear liquid. The NPH is going to be a cloudy because it does have some suspension in that fluid. After I've rolled them, I'm going to take a cotton swab. I'm going to clean the top. I will take another cotton swab and clean the top. Give it time for it to dry. Once I have done that, the first step we're going to do is inject 8 units of air into the intermediate solution. So having my nurse by my side that's going to verify that with me, I will take out my needle. I'm going to pull this down to 8 units. So 8 units, she's going to verify 8 units. I will take the cap off very carefully. I will put it into the intermediate without touching the needle to any of the fluid. I will inject 8 units into the MPH. Once I have done that, I will then inject 4 units of air into the insulin. So 4 units, verify with my nurse. Once I have done the 4 units of air, I am then going to go ahead and do withdraw 4 units of insulin. So pull this to 4. I'm going to go ahead and make sure I get rid of any air bubbles. Perfect. I'm going to have the nurse verify. That's 4 units. 4 units. After I've done that, I'm going to make sure none of the insulin gets into the intermediate solution. And I'm going to insert this into the intermediate and withdraw my 8 units. I need to make sure I don't go over. So total, I'm going to withdraw out to 12. Nice and slow so we don't go over. Once I withdraw 12, I will have the nurse verify that we've equaled 12 units. Perfect. And this would be what I administer to my patient. If for whatever reason if I prepared this on the table away for the patient, I would carefully recap it. So sliding the needle in, recap it. I would document the syringe and then administer it into the patient.